Firstly, can everyone hear me okay? Firstly, I'd like to thank the Council for convening this inquiry. Transparency has been thoroughly lacking throughout the STP process. I was one of the organisers of the recent Footprints March for the NHS between 8 local hospitals. The day we set off from Hartlepool Hospital, Hartlepool Council leaked the STP against the advice of NHS England. 2 days later, we Footprints Marchers attended a Better Health Programme engagement session after resistance from the organisers. I addressed the attendees towards the end of the session. Had the members of the public here seen this document recommending the closure of either Darlington or North Tees A&E department? Of course they hadn't. I witnessed some people literally shaking with rage because they had not been told this. At engagement events, we are continually told that this is about staffing. I'm aware that staff shortages are an issue. But if the crux of the matter was really staffing issues, I would expect to see a lot more information about recruitment and retention. Such references make up less than 2% of this document, and much of that is about changing the skill mix, which means saving money by hiring less qualified staff. In fact, it's expected that nationally there will be a third less GPs and 7,000 less registered nurses after implementation of the STPs. This is about saving money, not lives. Deficit reduction and a freeze in spending is a massive real terms cut. Every STP has a control total that it has to meet. In other words, it has to eliminate the deficit within a footprint. That happens everywhere. A core aspect of the STPs is demand management and activity reduction. North Durham CCG has already been using a referral management centre that screens, limits the numbers of patients being referred to hospital by their GP. Such demand management schemes lack an evidence base. There's an article in the Journal of the Royal College of GPs debunking a lot of the issues around demand management and referral management. This is about rationing, and this is about denying care. I'm sure it will be suggested that demand will be lower because we'll all be healthier, but as I'm sure you're all aware, the budget for public health, which is now devolved to you, has been slashed. The STPs also have very profound implications for social care. County Durham and Darlington Foundation Trust have said that there are up to 50 people occupying hospital beds at any one time because there is no social care available, but closures of community hospital wards are also on the cards. Homes will become virtual wards linked by technology. My partner's 92-year-old grandmother is cared for by her daughter, but if she wasn't there and his grandmother became unwell, I have no idea how she could get to grips, smartphone, quite literally, with technology. She's 92. Smart technology backed up by a voluntary sector that is already stretched to the limits and piecemeal visits from health care assistants. We all want to reap the benefits of technology, but I did have to chuckle just a little at the idea that technology will transform care in rural areas when it's probably virtually impossible in many of them to get a decent mobile signal, and the chance that you will not be able to access broadband even is a distinct possibility. This plan is not driven by the needs of the local population. As Carol said earlier, this plan comes from a template. This is a top-down, cookie-cutter implementation of a private sector-friendly new model of care. These new models of care are pushed in the 5-year forward view, which is a document from NHS England. And those new models of care, that template is imposed on all the 44 STP areas in this country. The STPs rely on a model of centralisation that is questionable. I don't think anybody has an issue with having a regional trauma unit at James Cook. You know, the NHS cannot do everything in every place. But the STPs rely on a model of centralisation that definitely does not work outside of dense urban areas of population. The Devon STP, which bears some uncanny resemblances to ours, funnily enough, also seeks to implement this model, despite the fact they have admitted that the rurality of the area makes it positively detrimental. The vast majority of the catchment area of Darlington Memorial is not an area of high population density. It is essentially rural or semi-rural. Many of the speakers have given many details about travel times and distances, so I won't repeat them here. What I will say is, obviously, the case for these services remaining at Darlington is extremely strong. But there's something else I want you to consider. Consultant Clive P. Dell tweeted a few weeks ago a picture of Darlington Memorial, which I'll distribute some copies later on. You may have seen it. He tweeted, "This A&E department is at risk of closure. Where will these 12 ambulances go then?" I would also say to you that if North Tees A&E closes, how many more ambulances will be queuing there? If the STP throws North Tees under the bus, so to speak, we will find that the casualties of that bus turn up at Darlington A&E. Patients will be lying on trolleys and corridors, whether they're from Darlington or Stockton, and people will die as a result, as they have elsewhere this winter. I will be holding a people's consultation on the STPs and their impact in Darlington in May, just prior to the legal consultation in June, and I'm asking you all today to get involved in this. I would urge you to abandon any notion that we can somehow achieve a favourable settlement within the STP proposals to insulate Darlington from the devastating effect that the STPs will have, and to oppose it outright. I urge you to resolve that the Council opposes the STP on the grounds that it will be detrimental to the health of people in Darlington, and call upon the CCG to work to procure new plans for the future of services. Darlington CLP resolved to do that in December, and I urge all of you to oppose the STP today. Thank you.